Hi, my name is Farah Sharif. I'm a consultant orthopedic surgeon with an interest in sports surgery, and I've had a special request from some of my athletes about a video on the causes of shoulder pain in athletes. So there are many athletes that get this. Specifically, it's usually the overhead throwers, the swimmers, the weightlifters, but also long jumpers can also get this, or triple jumpers, because they not only use their lower limb muscles, but they use their upper limb muscles um, just as important in trying to get the travel through the air to improve their distance. So the causes for this pain are very many. You could have it could be due to a sort of impingement type syndrome, basically overuse of with overhead activities. Here there is no specific injury, it's a diffuse type of pain, it comes on gradually, it's dull type of pain, and we as orthopedic surgeons can identify this very easily through the impingement test, like the Hawking-Kennedy test. The second cause is muscle imbalance, and here this is typically the dyskinesia of the shoulder, which is an imbalance between the anterior deltoid and the chest muscles and the rotator cuff. And again, this is a chronic vague type of pain. It's increased with endurance activities, and here with examination you will find an asymmetric scapular movement, and this improves with the scapular stabilization test that we can use. The third most common cause is poor technique, and this is very easy to identify from the history. So the athlete will have had a change in technique recently that has caused the pain. And when you examine the shoulder, you don't find any gross abnormality in the shoulder. And the way to diagnose this is through video analysis. The other cause, which is more serious, is instability in the shoulder, and here it's the athlete will get a sort of a clicking, maybe a clunking in the shoulder. There's possibly a prior injury through a dislocation. They may get like a dead arm syndrome, and here it's the history will also is very important, but the examination will identify it. You basically get like an apprehension. So when you put the shoulder into a abduction, external rotation, the apprehension comes on, and the athlete will tell you to stop because it is very painful and he feels the shoulder is going to come out of joint. Usually happens in young athletes. The other most common cause is an acute injury, and here this is very easy to identify. It's very sudden in onset, and there is a specific injury episode in the history. There is usually a point tenderness to the injured area, and the way forward would be to examine and then get an X-ray, maybe an MRI scan. The other cause would be a nerve-related type of pain, and here it's a very specific type of pain. It's burning, radiating, associated with tingling, numbness, and the most common pain associated is the scapular, suprascapular nerve. Another cause is poor recovery, and here it happens with usually at the end of the athletic activity, with endurance activity. The athlete will tell you specifically that it always completely settles down with a period of rest, only to recur with the endurance athletic activity, not at the start of the activity, but usually at the end. So I hope that this video helps athletes identify what type of pain they have, and obviously seek help from an orthopedic consultant specializing in shoulder surgery. Thank you.